So, hi everybody, hope you're really good. Thanks for listening in today. I am talking again today to the lovely Sarah from Medik8. I'm quite sure some of you watching this will have already watched the first couple of videos and chats that I had with Sarah, which was good, brilliant feedback from. So thank you, Sarah, for that. So Sarah talked in the first video about the kind of philosophy of Medik8, and they keep it really simple, talking about this kind of CSA philosophy. So it's vitamin C in the morning, your sunscreen, really important during the day, and the A stands for vitamin A, which is what most of us think of as retinol or retinal, and I know it's all very confusing. So the reason that, well, not the reason, I thought it'd be brilliant for Sarah to just try and kind of demystify all the kind of facts and stuff about retinol, because it is quite confusing. It's such a buzzword just now. It's such a phenomenal product. But, you know, there are people out there, and, you know, like, just to give you an example myself, years ago, I tried a retinol product. Of course, didn't read the instructions, slathered it all on. My skin literally, it was like a chemical peel. My skin literally peeled off. So I just thought I was allergic to it. But of course, I hadn't read the, you know, all that. So, so I think there's quite a lot of misunderstandings, let's say, out there about retinol. So, Sarah, so over to you. If you could just fill us in your lovely way that you do. That'd be amazing.
Try and make it as simple as possible. Well, I'll try my best. You're very, very right, Mads. Basically, vitamin A, it's the gold standard in anti-aging. It is the most incredible ingredient for everything. It's going to really help to stimulate that collagen synthesis, make it stronger, create that better support network for the skin. It's amazing for that exfoliation, the proliferation of dead skin cells. So it increases that cellular turnover, which is amazing. To keep that skin younger and fresher and smoother looking on the surface. It also really helps to minimize pigmentation. It kind of does a little bit of everything when it comes to anti-aging, but also preventing that aging process, which is why we call it kind of the golden ticket. I always think this is the one that's going to take me to the Willy Wonka's chocolate factory in terms of anti-aging, because it does a lot of everything. That being said, as we know, with certain ingredients, we do have challenges in terms of their stability. And I talked a little bit about this with the vitamin C. In terms of how it can be quite an irritant to the skin, it can be quite volatile. And where Medik8 have excelled themselves, as usual, is their formulations of how they've managed to really stabilize their vitamin A formulations. You're very, very right. Vitamin A isn't really the buzzword, it's retinol. But retinol is just a form of vitamin A. And what a lot of people misunderstand is that there's actually different derivatives of vitamin A that's out there on the market. So you've got kind of like your retinol palmitates and your retinol esters. They're what we call a carrier. So they've got retinol, or should I say vitamin A, present in them as an ingredient, but it's not at its highest concentration. Then you've got retinol, which is the most commonly known, the most commonly used. It's what you see pretty much on all the packaging and things like that. So with retinol, again, it's quite irritable for the skin. So you can see that my flowers on my windowsill is a reflection. I'm so sorry.
I didn't even notice. You're fine.
Did you not notice? It was driving me crazy because I could just see flowers over my face. Sorry about that. So you've got retinol, which, like I was saying before I got distracted, it's the most commonly used form of vitamin A in a lot, and that's where you see a lot on packaging and things like that. It's really important that you look at the packaging and the types of retinol that's in that product as well, because a lot of brands use palmitate esters and things like that, and the skin's got to convert these 3 times over to get to retinoic acid, which is what we want. Then you've got a retinaldehyde, which is quite new to the market. It's a Medik8 formulation, which just goes above and beyond, and it's far superior than retinol as well. But that being said, because they are an irritant to the skin, they have to have certain technologies to prevent, like you were saying, where you've got put it on and your skin starts to flake and you feel like you've had a reaction. It's all about using the product correctly so that you don't get that irritation. So with Medik8, we have 3 different formulations when it comes to vitamin A. And again, a lot of it goes on texture. So you've got your Night Ritual Vitamin A. Now, this is amazing for an introduction to a vitamin A product. We only ever use them on an evening because they're not photostable, so it would make it more irritable during the day. But this is the lowest percentage that we've got. It's a cream texture, so it gives you much more nourishment and support to the skin. And like I say, it's a perfect introduction. You've got retinol, which always comes in a serum base, so more like an oil-based serum. And this we do in lots of different percentages. And this is kind of like your next step up. And then you've got Cristal Retinal, which is our retinaldehyde. And again, you've got this in lots of different percentages. So what's the difference? It all starts, your journey starts with your preference and texture more than anything. Because as we know, especially with Medik8, we love to layer products. So it all depends on whether you've got that really dry, flaking, needs that extra nourishment. You're going to go more start with your Night Ritual because it's that cream. It's got that extra occlusives for that moisture barrier. If you like an oilier texture or a serum formulation where it soaks in really quickly and then you can really layer products on top, you'd go more for your retinol. And then if you want the ultimate kind of the most advanced technology, you want the quickest results, you're in a bit of a rush, say you've got a wedding in, 3 months' time, that kind of thing. And also you like a light cream texture. This is your retinal, Cristal Retinal. It's your retinaldehyde formulation, which is amazing. And that's also antibacterial. So you can use that, especially if you've got kind of that oily, congested skin types as well. So really, when we're talking about vitamin A, we need to introduce it to the skin because of that irritation aspect. So on all the packaging, the directions, which nobody ever reads.
Guilty.
When I first started with Medik8, I did exactly the same as you. I thought, how strong can it be? I'll put it on. Yeah, I very much regretted it quite quickly. So we always say to introduce your vitamin A products. So you can use them on an evening. They're going to go on clean skin after a toner if you're using one before you apply anything else. And you would start with a lower percentage and you're going to introduce it slowly. So it's twice a week for 2 weeks. Then you can increase to every other night for 2 weeks. And then once the skin has normalized and you're not getting any kind of irritation, then you can go to every night. Okay, that kind of makes sense.
Yeah. So like myself, so I use the Cristal Retinal. So I'm on number 10. So I started at number 3, did it the second night, and then moved on to number 6, and then I've just actually started number 10. So see, Sarah, if we're talking, say, if I had gone from number 3 to number 6, and number 6 was still kind of irritating, would I just stay on number 6 then? I would never progress.
Yeah, absolutely. That's exactly what you do. So you only really progress to your next percentage when you start to see your skin results. Because obviously when you start with a new product, you're going to start to see that increase in results. And then once you start to see it plateau a little bit and you're like, oh, I need to kickstart this again, then you'll increase your percentage and you'll go up and reintroduce it slowly again. So you'd go back twice a week for 2 weeks, and then every other night for 2 weeks, and then keep graduating, basically, is how I say it. It's like climbing a ladder. You can't climb to the next ladder until you're comfortable on that step, if that makes sense. So this has to become completely compatible with, for example, Cristal Retinal 3, which is what we'd start most people on. Once we plateau, we bump you up to a 6. And that can take you anywhere between from 1 tube of Cristal Retinal 3 to 10 tubes of Cristal Retinal 3. It's completely individual to everybody's skin. On a younger skin who's using the products more for like that maintenance program, they'll probably stay on Cristal Retinal 3 for quite a long time.
Well, that's what I was going to ask you. Sorry to interrupt you. What kind of age group then? Because obviously a lot of our clientele at Lumiere kind of, more middle-aged, if you like, and obviously we're all talking about retinol, but what kind of age would you recommend that people start?
We say anything with Medik8, you wouldn't really treat under the age of 18 just because their skin's still developing, hormones are still playing very much a part in their general skin health. But with vitamin A, probably around 2021 is when you can really start using it as a preventative. And again, it might be a case where you use it instead of upgrading to every night, you might just use it a few times a week for 6-12 months, but that's where it becomes really important to have that practitioner kind of assess your skin, decide which formulation is going to be the best one for a client's skin, especially if they are in that younger age bracket, because you don't want to overstimulate the skin around that later teenage years, early adult years. But then at the same time, we want to start them nice and young to create that prevention, because let's be honest, prevention is always easier than the cure.
And the golden rule still, if you're using vitamin A, well, we should be using sunscreen all the time anyway, but golden rule, must use your sunscreen in the morning.
It does have a thinning aspect to the skin, which is why we don't want to start people on it too young. It takes years and years and years for you to really feel a difference in terms of the thinniness of the skin. So don't consider it as like, oh, this is going to thin my skin, I shouldn't use it. I live in Yorkshire and the sun has finally made an appearance, but now I can't see anything. But yes, so again, when you're treating younger skins, always speak to that practitioner, speak to somebody who knows about the product so that they can really bespoke it to them. But they might use it a few times a week before they eventually upgrade to every night and that kind of thing. And this is what I love about Medik8, is that there's always a journey. You can always go somewhere with the products and with the percentages and things like that for your own individual skin needs. It's not one rule suits everyone. Yeah. Never be with skincare. I'm a true believer of that as a practitioner myself. No one size fits all. Yeah. It needs to be a bespoke treatment plan for that individual. So as much as, yes, vitamin A is so important for the skin health to really create that prevention and that cure for anti-aging, it's also really bespoke to the individual.
Yeah, and I think that's what I love about it, having it in Lumia as a brand, because Medik8, the training's brilliant, the support's brilliant, and the girls are really starting to feel confident about it. They all use the brand themselves, all of them, from amazing. Different ages. And I think, they're starting to get brilliant feedback from people, that maybe had it at 6 months, and they're seeing their own skin improve. We're getting brilliant feedback. And that's grown their confidence. And, I do like the way Medik8 just kind of keep it simple, but to get the results. And at the end of the day, that's what we're all looking for.
100%. I'm exactly the same. I mean, I only started with Medik8 back in March myself. So, I'm still technically, I suppose my skin's still quite new to it. But obviously, the way the world has been, I'm now starting to see people that I've probably not seen for a very long time because they live in different areas of the country and things like that. And everybody I see now is like, what are you using on your skin? It looks different. And I'm just like, thanks. And these are people I've known for years. And I mean, I am a practitioner and I've worked with many brands and I've always had a really good skincare regime. But at the same time, when you're now getting people comment on your own skin, you're like, hang on a minute.
Absolutely.
I love it.
I know. Right, listen, thank you so much, Sarah. I know you're a very, very busy lady. So thank you so much for taking the time to do this. And I feel as if I've got loads more to talk about. So, I'll definitely be chatting to you again soon.
Absolutely. Anytime, Mags, for you.
No problem. Thanks a million. See you later. Thanks, everybody. Bye. Bye.